welcome everybody to today's Methods Matters webinar, which will be about an hour in length. My name is Belinda Jampo, and I will be the host today. And I have my colleague on the back end helping, Amber Huey is also helping us. So our webinar today is entitled Using Natural Language Processing and Social Media Listening in Patient-Oriented Research. And it will be presented by Nick Dragojevic, Larry Lind, and Nick Bansbach will be our moderator. Next slide, please. Our Methods Matter series is actually a monthly webinar series for the BC Support Unit Methods clusters, and it showcases emerging research in patient-oriented research methods. Next slide, please. So I would like to also begin this webinar by acknowledging the ancestral, traditional, and unceded territories of the Musqueam, Tsleil-Waututh, and Squamish nations from whose lands the BC Support Unit operates in. So everybody joining us, please feel free to use the chat box to acknowledge the ancestral territories that you are joining us today from. Next slide, please. We encourage an attitude of continuous learning. So we'll be approaching new ideas and diverse perspectives with openness, respect, and curiosity. The aim here is to center previously underprivileged voices. So that's it for me, and I would like to begin today's webinar by passing it over to our moderator to introduce our presenters. So over to you, Nick.
Great, thanks, Melinda. Hi, everybody. I'm Nick, and I'm fortunate enough to be the co-lead of the Health Economics and Simulation Modelling Methods Cluster at the BC Support Unit. I'm also at the School of Population Public Health and at CHAOSS. And it's a real pleasure for me to introduce Nick Dragojevic and Larry Lind, who are both at the Faculty of Pharmaceutical Sciences and at CHAOSS, because they're going to talk about a methods project that was funded by our cluster. So I'm just going to hand over to them. Please be thinking and writing questions for later, but I'm going to pass over to Larry.
Thank you, Nick, and thank you, Belinda and Amber. And thank you to the Methods Cluster for the invitation to present today in this inaugural SPORE webinar. I just want to give a very quick background and a bit of a genesis on this project and where it started. Is in our group, we're often, and we do many patient preference studies, which often involve kind of a long, rather expensive and painstaking process of a series of focus groups to try and understand, a patient's experiences and their preferences and what's important to them. And then we move into, a choice experiment, a discrete choice experiment, or a best worst scaling experiment that can take a long time. And oftentimes we run into these situations where maybe there's shocks in the system where we get a new treatment or something has come out in the media. And in fact, maybe people's preferences and experiences change in the middle of your project. So, thinking about different ways that we could do this more efficiently, I'll give full credit to Nick on this, and he came up with this idea of potentially using data that already exists in social media where patients are often talking about their experiences and whether or not we can tap into that as a source of data and information that we can learn from. So we made some valuable connections with our colleagues in computer science and developed this methods project around natural language processing and social media listening. So today we'll present kind of what we did in this project, and at the end I'll wrap up. We were talking a little bit as we started about some of the interest and some of the broader applications of this where people are interested. So I think there's potential for some significant value of this moving forward. And with that, a quick thanks to the Methods Cluster for the support. It's been a real catalyst in launching this research area, and I think as we move forward, it will continue to develop. So with that, I'm going to turn it over to Nick to get into the details of our project.
Well, thank you, Larry. So I'd like to start off by just providing some background on the motivation for our work and on where we think it fits in the broader field of trying to understand patients' preferences and experiences. And as Larry had indicated, often there are a lot of studies that are done in this area to try to provide valuable inputs into decision making at all stages of medical product development and healthcare service development. One thing to note is that over the last few years, there's been a number of studies published by a group in the Netherlands that has been doing a lot of interviews with a variety of stakeholders in the healthcare system, ranging from patients, medical product developers, regulators, et cetera, to try to understand how patients' preferences and experience are being used to inform these decisions and how that might be. And it's clear that they are being used all the way from discovery and product ideation, prototyping, all the way through to approval, reimbursement, and post-marketing acceptance. And the goal here is to accelerate the trend in patient-centric product development and management, which is becoming increasingly important as a principle for both industry and governments. And the goal is to maximize the fit between patients' profiles or patients' preferences and needs and product profiles. So one thing that this research by the group in the Netherlands has pointed out, though, is that what different stakeholders understand as preferences and patient preferences is a bit different. So academics tend to be very much focused on patients' choices, values, priorities, and trade-offs in particular. And whereas other stakeholders, including regulators, for example, are definitely interested in those aspects, but also in a broader set of experiences, expectations, needs, feelings, and the right type of method to get at those different types of what they call patient preference information can vary. So they classified the general research methods into two categories. One is preference exploration, where basically you try to get a general sense, starting from basically nothing, about a specific patient population's needs, experiences, preferences, what they value, what they think is important. And often this is done using qualitative research methods like focus groups or interviews. And then there's preference elicitation, which is usually follows on further down the line, where you have an idea of what might be important and you're trying to quantify just how important each factor is in patients' decision making or thinking, and how that, how they might trade off different factors like risk of side effects versus the potential benefit they might get from a drug. So in the end, the conclusion is like mixed methods provides the most comprehensive insights into patient preferences, needs, and experiences. An emerging method particularly for preference exploration that combines elements of both is social media listening, which, as Larry mentioned, involves looking at, leveraging existing data and existing text produced by patients on social media to try to start that exploration process in terms of understanding patients' needs and preferences and experiences. And it has notable advantages or potential advantages over existing methods, both quantitative and over things like focus groups and interviews. On the one hand, it draws from real world conversations as opposed to conversations that are happening in a constrained research context, which might actually allow for different sort of perspectives to come in. It captures maybe a different cross section of the patient population. Instead of having maybe 30 participants in a few focus groups or in interviews, you might be able to get data and try to understand the needs of a very large number, thousands of patients at once, without necessarily doing a survey, and looking at how they express their needs in their own words. It also has a potential for longitudinal tracking of preferences, if you can look both individually and as a group, look over time how preferences change. And perhaps most importantly, or this is certainly what got us thinking about this, is the potential for efficient data collection by leveraging that existing data set, basically, of social media, which is very large. This can lead to faster, less costly research into patient preferences, and in fact, lower participant burden by not requiring or not asking so much of patients in terms of sharing their experience specifically in the context of a research study, particularly if that is already out there on social media. And more papers are being published using this approach by a range of stakeholders, including obviously academic researchers, but also pharmaceutical companies and others who are finding it a valuable approach. However, there are still, most of these studies are still using human coding, so qualitative, so people going through each post and coding them as, say, positive or negative, and what the themes or what types of things are discussed in those posts, which limits its scalability and the potential to really leverage that big data and some of those advantages that I just discussed, because you need a significant human resource investment. So our intuition was that emerging methods of artificial intelligence and natural language processing might present an opportunity to automate that type of analysis of social media data and allow people to use that as part of patient-oriented research. And then that by lowering the cost and the difficulty of conducting this type of patient preference research, this might improve the patient centricity of medical product development by increasing the frequency with which stakeholders at all levels seek to inform their decision-making with patients' own experiences and stories and preferences. So that was the motivation for us pursuing this project. So our goal for this specific grant was to, well, we had three objectives. One was to develop a prototype software tool for semi-automated discovery of patient preferences from text, and then explore the types of data that might be extracted from social media text in particular, given that it's already there, and then assess the adaptability of our approach maybe to other domains and to other types of data. So I'll focus primarily on 1 and 2 today, but we can definitely talk about 3. Both, I think Larry's going to comment a bit on that at the end of the presentation and in Q&A. So before I go into the details of our study, I think it's important to start with a quick overview of a few key concepts from natural language processing that will hopefully set the stage for the rest of the presentation to be most beneficial. The central component of our NLP strategy and our NLP analysis was what's called aspect-based sentiment analysis, which is more granular than maybe other approaches that you might be familiar with in terms of sentiment analysis, where the positive or negative sentiment associated with a text document, whether it be a social media post or an email or even just a memo, tends to be coded at the document level. Here, you're actually, the system's actually assigning sentiment to specific words within the text, which actually presents a lot of opportunities to really dig into the text and the meaning, as I'll describe over the next few minutes. So a few key concepts. First is the opinion, an opinion word, and that's, as you would expect, it's a word that's expressing an opinion, so a sentiment, positive or negative, about a specific aspect. So, and what's the aspect? The aspect is the object that's being described by the opinion word in a given sentence. So for example, here are 2 examples. There's a positive and a negative example. Both of these, Ocrevus and Tecfidera, are drugs for multiple sclerosis. And here's an example. I was doing great on Ocrevus. So here the aspect is Ocrevus. And the opinion is great, which is positive. So basically, that's a positive sentiment being expressed by Ocrevus. And in this sentence, I am worried about going on Tecfidera, and there the aspect is Tecfidera. The opinion word is worried, and that is expressing a negative sentiment about that drug. And so what happens in aspect-based sentiment analysis is that pairs of these aspect opinion pairs are extracted, as in these sentences. So you're able to basically infer the sentiment about the aspect from those pairs. One final thing that is not necessarily standard in this type of analysis, but that we have integrated into our system is topic segmentation. So basically, we used an NLP algorithm to basically, when there were posts on social media with many sentences, so very long ones, and there are a number of those, probably there may well be a number of different things that are being discussed on those posts. And so this algorithm breaks those posts up into groups of sentences that are talking about the same topic. And that's important because it allows us to look at what sorts of different types of aspects or terms are being discussed in the same context. And that helps to understand broader trends, and as I'll discuss in a few minutes. So the specific system we based, or specific software that we based our system around is ABSAP, which is a open source software for aspect-based sentiment analysis that was created by researchers at Intel and Bar-Ilan University. And although we've made a number of tweaks and adaptations to it. And basically the way this works is that you feed it the source text, it runs through it and identifies the opinion words. It then sort of analyzes a text structure, the structure of the sentence around that each opinion word, and tries to find the associated aspects, so what the opinion is talking about. And then when it finds one, it extracts those as an aspect opinion term. The opinion words have a sentiment generally associated with them. So for example, delicious is generally a positive word. However, the system also takes into account other factors. So negation, for example, if you're saying the salad was not delicious, that would then flip the sentiment that it's inferring about the aspect and say, no, actually that salad, that was a negative opinion about that salad. And so it does this and then generates, it can generate aggregate estimates about the proportion of positive and negative mentions of each type of aspect. Now, for those who may be familiar with machine learning terminology, this is a weakly supervised system because the actual algorithm that is used for that first pass is just, it's not learning from the data itself. It's already pre-established, and a lot of it is actually rules-based rather than trained on other data. But then the weak supervision aspect means that there is a human in the loop. So once that first pass does is it creates a list. Not only does it extract the aspect opinion pairs, it creates a list of aspects that were found with sentiment in that source text. And so that's called the aspect lexicon. And so what the human can do then is, so the researcher can go through that aspect lexicon and try to identify, what aspects were relevant and which ones weren't. So if, for example, you're looking at, it's analyzing data from a patient discussion forum, but someone happened to mention how they, oh, by the way, yesterday I had a best hamburger at this or that restaurant. Maybe hamburger is extracted with a positive sentiment, but that's not really relevant to our objectives in this sort of research. So that's where the human, and so you can exclude hamburger from that aspect lexicon and you can focus on the things that really matter. And that can vary depending on your application. And I'll describe how we did that ourselves in a couple minutes. So in terms of developing this prototype, as that was our first objective, we decided to focus in on a specific context. One is basically on aspects relevant to drug therapy decisions, basically decisions by patients on which treatment to go on, and particularly on chronic conditions with multiple treatment options. So conditions like multiple sclerosis or rheumatoid arthritis, where there are a lot of potential treatment options. The reason for that is that it's particularly in those contexts where there's a lot of treatment options where the patient's preferences are most relevant from a policy perspective in terms of what drugs are informing policy and potentially further drug development. If there's really only one treatment for a condition, that will be less relevant. So we focused on those. We also decided to focus on data from reddit.com, which is a lot of you will be familiar with, is a discussion forum website where you can create a specific forum for a specific topic. Those are called subreddits in Reddit parlance. And so this is an example. Here's a screen cap of the multiple sclerosis subreddit on Reddit. And we did that for a number of reasons. One is that it's fairly high volume, but also that it's got those specific disease-focused forums, and it does have an API which allows you to easily download that data. A lot of other sort of forums may be associated with patient organizations, may not have as much volume, but also often the terms of use say you can't scrape that data, and certainly there's not an API, so that's harder. Now, this is not to say that the results and our method is not applicable to other social media. It certainly is. We just decided to focus on that for our development, and I'll be presenting some results from the Reddit data today to illustrate how this can be used. So I can say more about this in Q&A in the interest of time, but basically one of the first things we did was to look at how many, in this first pass of ABSAP, the core software going through text data, like how many aspects were extracted into the lexicon, just to understand whether this is going to be an infinite growth in aspects or whether it might stabilize after a while, which would make the plausibility of using this on very large data sets better. And so what we did, we sequentially added some data from the multiple sclerosis subreddit, then added some more, looked at how many aspects, then added some data from some other subreddits. And what we found is that even though we were adding data from other conditions and just getting progressively larger, doubling the size, it seemed like the number of distinct aspects sort of stopped growing at around 1,000 that were extracted from that. So that does suggest there are only so many things that are being discussed on these forums, and makes it more plausible to use this in a scalable fashion on very large data sets. Also makes it plausible for humans to refine this. If there was 100,000 aspects, that would be many weeks of work to refine this, whereas this refining this number of aspects for a new application is much more plausible. So in terms of how we refine this, that was our next step, was to take that initial lexicon extracted from those 50,000 posts from a variety of subreddits, which were 1,016 aspects, and 2 coders reviewed each aspect. In particular, they reviewed each 20 examples, so sentences in which that aspect was extracted from for each of the aspects, and reviewed each of those sentences and examples to try to decide whether it was the way the aspect was being used was relevant to treatment decisions or not. And so the 2 coders did that. There was a standard methods for agreement and resolving disagreements through consensus. And then aspects for which more than 80% of examples were deemed to be relevant were retained as aspects, just to make sure that we focused on the things that were most relevant to our research question, which was treatment decision making. Finally, those aspects were assigned to 11 different thematic categories that were developed in reference to the literature on patient preferences. So things like side effects, effectiveness, alternatives, route of administration, etc. Those don't have to be the categories you use, but those are the ones that we thought were relevant for our study. We also supplemented the lexicon with a list of disease-modifying drug names in MS. So, okay. One thing we were interested in, though, was how well was this ABSAP, this open source software, working in terms of identifying aspect opinion pairs and assigning sentiment to the aspects. So we took a random sample of aspect opinion pairs, and 2 coders evaluated each pair independently for 2 questions. So did the opinion word in that aspect opinion pair actually describe the aspect? Like, was it making that association correctly? And was the polarity correct in that context? Was it assigning the right sentiment? And overall, it was actually fairly effective, particularly since consider that this software was developed originally using a body of customer reviews, which is fairly different than just free-flowing discussion on discussion forums. So over 70% of opinion words were correctly assigned to the related aspect, and 72% of opinion words assigned the correct sentiment. Now, when you take both of those into account, there's still a majority of aspect opinion pairs had both the correct association and the sentiment. So that's actually pretty impressive for unsupervised software. Definitely room for improvement, though. So one of the things we discovered through that process was that there are a number of recurring issues that cause a lot of the sort of incorrect inferences. So one of the ones we found was like, which is a word that in the context of customer reviews is used a lot, as in, I like this about this phone, I don't like that. As it turns out, in this sort of data, that was the most common extracted opinion word, but it never was, that we can see, it was never used in that way. It was always used as a conjunction. So basically comparing one thing to the other, this thing is like that thing, or just as in like, and so in neither of those cases were those correct inferences. So we excluded that opinion word, we excluded a few other terms, and precision improved from 57% to 65% for aspect opinion pairs. And we've done we're working on a few other things to further improve that precision. So overall, seems fairly reliable. We also have no reason to think that the errors will be sort of different for different aspects or different areas. So any trends or comparisons we do should be unbiased, we think. So basically, we can still should still be meaningful. So we then, having developed that initial sort of pipeline, we extracted all the data we could from the multiple sclerosis subreddit and analyzed it. And here I'll present some overall results that I think are interesting. So one thing we noticed from 2015 to 2020, the number of actual conversations and posts on the MS subreddit grew substantially. And similarly, the number of aspect mentions or extracted grew as well, from just under 10,000 in 2015 and over 50,000 in 2020. So it grew by fivefold in that period. Additional thing to note, in addition to ABSAP, we also wrote, our computer science collaborators wrote a script that would detect the use of the words in the aspect lexicon that we thought were relevant, but that were not extracted with sentiment by ABSAP. So to try to understand like what proportion of the total times that these words were used, were they being used with sentiment, or maybe they were just being used with neutrally, just describing something. It turns out actually between 60 and 70% of total mentions were extracted with sentiment. So that's definitely suggests there are a lot of opinions being entered into these forums, into these discussions. So one of the things to look at is the sort of how much the different disease-modifying drugs, or DMDs, were mentioned over time. And so this is a admittedly dense graph, but showing the most frequently mentions, the relative frequency of the most commonly mentioned disease-modifying drugs over time. And remember that the overall number of posts was growing. So this is the proportion of the overall discussion in each year that was focused on specific drugs. And a couple of things to mention. One is actually probably the most interesting thing is the Ocrevus. So that's a new drug that was approved in 2017, and it's growing, basically grew dramatically. It's now in 2020 was about 30% of all mentions of disease-modifying drugs. That was just for that drug. And this compares, contrast that with Mavenclad, which is a 2019 approval. And there, like, it is growing, but it's a pretty small, only a couple percent of the total. Contrast that also with Tecfidera, which was approved in 2013, or for that matter, Lemtrada here in green, the green band, which was approved in 2014. So just 1 year before our data starts. And there, I mean, it's not insignificant, the proportion of the overall discussion that's focused on that, but it's pretty stable. It doesn't grow like Ocrevus does. So that's actually quite interesting. There seems to be a lot of emphasis on that drug specifically amongst patients posting on this forum. So why is that? Is it that they love it, or they hate it and they're complaining about it? So that's actually where a number of aspects of this system can help to speak to that. So one of the things we can look at is the overall the distribution of sentiment for each of those drugs. So basically, how many were positive mentions, how many were negative mentions, how many were mentions that were extracted without sentiment. So it turns out actually Ocrevus is the second most positive drug. So one way to look at positivity is to look at what proportion of total mentions extracted with sentiment, so positive and negative, was positive. And here 66% of those mentions for Ocrevus was positive, and 81% for Mavenclad, that other new drug, although that's a much smaller number of mentions. And compare that, so these are both new drugs, so apparently it would seem that they're being discussed with a fair amount of positivity. At the bottom of the list, we find Evanex and Copaxone and its generic equivalents, which are older drugs approved in the 1990s. And those are fairly negative, especially Evanex, which was only 44% positive, so 56% negative in terms of mentions. So there does seem to be a contrast there. So one thing we can do with this data is then try to understand, well, why is this the case? What might be driving that? And this is where co-occurrence analysis is particularly valuable. And so remember, if you think back to what I was talking about a few minutes ago about the topic segments. So what this graph is showing is the frequency with which different aspects, categories, so categories of or themes, if you want to think about them that way, were mentioned in the same text segments as as these drugs were mentioned. So in the main thing to note here is that in the case of Avonex and Copaxone, the two drugs with the lowest positivity overall, the frequency of mentions of side effects and mode of administration were both quite a bit higher than for the two drugs with a positive sentiment overall, so Mavenclad and Ocrevus. So that does suggest that maybe that difference might explain the overall sentiment difference. So to drill into that further, we can look at the sentiment associated with these mentions of side effects and effectiveness and mode of administration. Notice that effectiveness wasn't very different. So that's, that does seem to be, it's not finding that for everything. So if we look at the relative sentiment, so the positivity percent for the different types of aspect categories co-occurring with those drug mentions, you actually find that, again, Copaxone and Avonex had very negative, or so had much less positive, much lower positivity associated with mentions of mode of administration and side effects than for Mavenclad and Ocrevus for mode of administration and side effects, but not for effectiveness. Here, notice that effectiveness positivity is about the same for the Copaxone and Avonex as for Ocrevus. So that does suggest that might be driving. There's a face validity to this in that Copaxone and Avonex are both injections, injectable drugs where you need to take a weekly or even more frequent injection, whereas Ocrevus is an infusion that, admittedly, but it's only every 6 months, and Mavenclad's an oral mode of administration, so a pill. So that does kind of point to that maybe being an important factor, and same with the side effects. Now, this is not the end of it, obviously. I think this illustrates the value of this sort of approach, and that now points to some potentially important trends, which can be further drilled down into either using this system by further breaking down, looking at, well, what specific aspects in mode of administration and side effects were mentioned and how did they compare across drugs, or by pointing to follow-on studies that one might do using other methods like focus groups, interviews, or surveys. So it's actually seeming to work very well for preference and experience exploration. Now, there are some limitations, obviously, to this system. First, I mean, I'll go through these quickly, but basically accessing a broad array of text data, particularly for social media, can be quite challenging. So again, we used Reddit because it was easy. Getting other data in both just getting it and in a format that is easily usable is either takes a lot of work or a fair amount of money to go through data brokers. So in terms of applying that there are some questions to how that might be applied routinely in a healthcare research context. The demographic metadata is fairly limited on social media, so it's probably going to be a challenge to do fine-grained demographic comparisons. There is lexicon refinement that is likely necessary for movement into new domains, just at the very least to make sure that there's nothing really important new that's being missed by the old lexicon. So there is that investment necessary, and this also creates very multi-dimensional data, which actually requires a fair amount of time and skills in terms of data manipulation and visualization to actually start to get a grip on it. And creating those charts, for example, for this presentation took quite a while. So this, however, the last limitation is one we tried to address in this project as well by creating a user interface that end users could use to directly explore the data and look at sort of, for example, the proportion of mentions for different aspects or the number of mentions and the relative sentiment distribution change in that distribution over time. And then if you click on those, you can maybe then it links you to points you to specific sentences in which those aspects were used, and you're able then to link to the original post on Reddit, for example, or in the case of other social media, other platforms, and to basically gives you the full context for those mentions. Now, I should note that these interfaces were developed in close with very valuable feedback from our two patient partners, Marilyn Lenz and Sarah Lehere, who provided information on user requirements, how well each feature was working and how easily used it was. They also pointed to a potential patient use case which we had not thought of. We'd originally thought of this primarily as a tool for, let's say, professional researchers in this space, but they actually suggested that because patients often use social media to try to understand other similar patients' experiences with different drugs, et cetera, to inform their own thinking about it, but there's so much of it out there, it might actually be quite useful to have a tool that could easily summarize the sentiment with which different drugs are mentioned over time. And we're definitely exploring that as an additional way to sort of use this going forward. And that was, again, I think illustrates the value of engaging with patients directly as part of the research through all stages of the process, and taking and working with them as partners. Now, for those who want, more in-depth analysis, we also have like features like a pivot table that allows you to do that co-occurrence analysis and exportable, and really like look at that data in a detailed fashion and export data tables, custom charts. And Larry will talk a bit about this, but that's one of the core features, or one of the core things that is informing our emerging collaboration with BC CDC on looking at social media and what that can tell us about vaccine acceptance for the COVID-19 vaccine. I'd like to quickly, before Larry says a bit more about where we see this going, just thank our collaborators, so teams from Pharmaceutical Sciences, UBC Computer Sciences, our patient partners, as I mentioned, and the BC Cancer Agency. And of course, thanks to the BC Support Unit and the HSN for funding this project. And so over to Larry.
Okay, thanks, Nick. Just very quickly, I'm being conscious of the time. Nick did mention, he talked about the refinement of the lexicon, and we can see, smaller incremental gains in or increases in the aspect lexicon as we added new disease areas. So we envision at some point we could reach a point of steady state and decrease the workload required to actually move into a new disease area. And one of the pieces that we're looking at is actually being able to, say, for instance, integrate this with Medline mesh terms that would really cover the breadth of different medical terminology at least, and that would cover that off. So we're exploring that as an opportunity. Nick did allude to some of the data that we've started working on with the BC CDC, their interest in vaccine hesitancy. And I think this is a really good opportunity and indication of how nimble this approach could be, given that, we all know on a daily basis, depending upon what's in the news of, which vaccine is causing which side effect, or what's the latest real world evidence that has affected our understanding of the efficacy or effectiveness in the real world. You can see where, somebody like the BC CDC could do this on a weekly basis and look at different shocks to the system and how that might have changed what the experiences or beliefs or preferences of the public are around this. Looking at another project we're looking at is there's a real interest in patient experience with some of the policy changes that have come about with biosimilars in the treatment of rheumatoid arthritis and other diseases in the biosimilar space. So, again, to very quickly to be able to evaluate and monitor patient experience and switching or initiating on a biosimilar. So we're looking at moving on a project related to that. And you can see there's significant interest too from the private sector. If you think about it from an industry perspective, to actually really monitor the environment that they're working in and get an understanding of what the patient experiences are in that environment to inform moving forward. And moving beyond healthcare, our colleague in computer science, Raymond, has been speaking with the provost's office at UBC, who's really interested in learning more about the student experience. And there's lots of free text data that students provide on course evaluations and instructor evaluations in their UBC experience. And so they're looking for a way that they can actually use this information to inform what might happen within the academic environment. So we're looking at that as a potential application as well. So you can see the applications of this I think are far reaching beyond what I even anticipated as we moved into this project, which I think is really exciting to have had this, catalyst support from the support unit to help us start this. And I think there's lots of opportunities for us to move forward. And with that, I'll stop there and we can open up and I guess I'll turn it over to Nick to moderate the Q&A session.
Great. Thank you both. So Nick D, join us as well. So keep asking questions in the question and answer chat button at the bottom of the Zoom screen. If you want to write something anonymous, then just write that into your question. But I think it's just thank you both, because I think this is a great example of a methods project. This is something that is patient oriented and showing that we need to develop new methods to do patient oriented research better. So I think it's a great example. I'm going to start off with a question.
Actually, Nick, before you start, could I make a clarification based on a question I just got from Amber? And I apologize. Yeah. Oversight on my part. Amber just asked the question of me, which is appropriate. She says, "What's a biosimilar?" So I'll just clarify that is this project that we're doing around biosimilars biosimilars are really generic biologics. So they're not truly generic drugs. So it's not like, getting a generic penicillin, which is exactly the same drug. So it should be exactly the same. The biosimilars are essentially generics of biologics, which are expensive, around $20,000 a year, for instance. They're slightly cheaper, but they're not exactly the same. So there's a lot of interest around whether or not people can be switched to a biosimilar and what their experiences are in terms of effectiveness and side effects. So thus, the specific interest in the biosimilar environment. So thanks for the question, Amber, and I apologize for not answering that.
Great. So let's just start off from a patient's perspective. You sort of talked about how there's this potential use for sort of rapid overview of social media discussions, but thinking about this from a research point of view, let's just sort of help us understand, how can patients benefit from this method?
I'll start with that. I think Nick and we certainly had great input from our patients, and I think Nick touched on it specifically, as if we can actually make this work the way we hope we can, and I've worked on it and I understand how it works. If we can make this really user-friendly and really intuitive, I think from a patient perspective, it could provide them with a really valuable tool of a way to really understand other patients' experiences and preferences for treatments that they might be considering, or different experiences in different disease environments, without having to weed through 5,000 or 10,000 posts and read them for hours on end. And I think that the same applies across all different stakeholders and perspectives, is to give a really quick understanding about the sentiment and experiences of different things in different research environments very efficiently.
Just if I could answer, just follow up on that very quickly. So I think one of the broader visions is that by making it low barrier to entry and low cost, it would actually expand the set of stakeholders who actually try to engage with patients early on. So for example, life scientists, when they're just starting to think about what sort of product should we develop to treat a specific condition, they can actually do this quickly, whereas now they're probably not going to go and do a focus group or interviews.
I think
I'm going to keep going, Larry, because we've got some questions coming in. So I'm going to just the first one here is about how people who participate in social media are likely different from those who don't, and how can one estimate how representative social media are of patients in general?
Actually, I'll just touch on that for starters, because I was actually going to make a comment about that before you appropriately cut me off, Nick. So this is perfect, because that was going to be my comment. Is I think from a researcher perspective, and we know that people who enroll in randomized controlled trials are different than those people who are ultimately going to be treated by the drug. We know that anybody that enrolls in research are probably systematically different from the general population in that environment. I think what's really interesting about this is even if we get individuals into a focus group, it's going to be specific types of individuals that come to the focus group, and what they say could be influenced by a very strong person or a strong personality in the focus group. So you do get that bias of what you might get out of that particular environment because it is a research environment. I think what's really interesting about this is real world information that you get from patients that may be less likely to be influenced or biased by something that they might be impacted by immediately, realizing lots of the discussion on a discussion board could influence what they say. But I think this is kind of, in this research environment, we talk more and more about using real world evidence to help inform our decisions. From my perspective, I really like this because it's more like real world evidence and experience of the people at the cold face of the decisions and the use that I think I'm hoping will provide us that added value over and above what we might get from a research environment.
I think the idea is to make this this would be a complementary method to others, so that might be able to get at different patient populations using different methods, but maybe with this method capture some patients who you might not find in focus groups, for example, maybe younger patients who are or others who might be less likely to be able to come to a focus group.
Let's just move on. Misinformation, that's an interesting topic right now, but I think the one question is about how sometimes certain groups will deliberately spread a large volume of misinformation. And how can this tool be used in a way to avoid oversampling a very vocal minority group?
Well, we do have the data at sort of the individual poster level, so you might be able to. I think one of the things to look at next is if looking at sort of average metrics per poster or something along that line, so that you can weight things by how frequently maybe they post. That would be one way to sort of de-emphasize a small super vocal minority. And again, who knows what the right answer is, right? But I mean, it's like basically the more ways to explore the data, the better, I think, to be able to present. And so I think there's certainly additional things we might want to integrate into the user interface and certainly present in when we publish this, for example. So.
Yeah, and I think I'll just say, I think that's a great question. And I think that just consistent with, I'm an epidemiologist, lots of other epidemiologic research that we do, we look at outliers and how they might influence the results. And I think that holds for this as well. And I think we have the opportunities to do that. We haven't done that yet, but I think that methodology holds for sure.
Another question about whether there's a risk that the analysis will reflect kind of researcher assumptions about what is and isn't relevant if the patients aren't directly asked. Good questions here, by the way. Keep them coming.
I mean, I think that is a good question, and certainly that can be something that would happen. I think, particularly with a human review, I think one of the big benefits of this specific approach, how we implemented this, is that unsupervised sort of first pass at the data. So you get all that aspect lexicon with all sorts of different things, including things you might not have thought of. A question of, I guess, the potential researcher bias, I think, enters when you start filtering that and deciding what to focus on and what not to focus on. That's certainly an appropriate thing to consider. One of the reasons to try to automate that to some extent by looking at sort of taking a very broad ontology like MESH, for example, and integrating that into the process, I think, is to try to minimize the chances that you miss something or just something you hadn't thought of that that is still relevant to healthcare and to patients. But.
And I think that also raises the question of the source of the data that you import into this process, right? And then we know that there are moderated discussion boards out there that are limited to patients, and we know that there are others like Twitter or Reddit, for instance, that are open to potential influence. So, you could have somebody come in and try and influence the discussion and shift the discussion in a particular direction. So I think it's also incumbent upon us to really adjudicate the data sources that we were bringing in and understand those potential options or opportunities for the sentiments that come out to potentially be influenced or biased by how broad or how narrow the membership of the discussion board is. Realizing, of course, I mean, we haven't just, Nick didn't touch on this, but in our MS study, we'd actually done focus groups. So we actually applied this methodology to our focus group transcripts, as well as the public discussion board from the subreddit. So it broad applicability. So, you can have small groups with rich text that you can apply this to. And we're actually looking at the potential of one of our next projects to do something similar, is to do a methodologically sound qualitative analysis on a particular study, and use this in parallel and do some comparison to say, could we be more efficient in doing this using a new methodology?
Sorry. One thing we did find for the MS focus groups was that the aspects extracted from the focus group text were entirely overlapped with the aspects extracted from from social media sources. So we do think the conversations are similar that are going on.
Okay, I need your tool to synthesize the questions coming in here to get the common themes. But I think I found one which is coming up in a few questions about validation. Like, how can you validate these approaches so that you know that actually this is working well?
Nick, I'll let you talk to that, because you and Nikki did a bunch of this, at least at one level.
Yeah, so I mean, I think that's a very important question. We've certainly been giving a lot of thought to that. We haven't quite gone to doing a full validation, but I think one good way to think about that is like a micro validation and a macro validation. So we started with a micro validation, like what I was describing, in terms of looking at individual coding to make sure that the actual procedure is working right. Then in terms of how to validate the conclusions one might draw from that, we do have plans on doing that, for example, by mapping the sort of themes that come out, or the aspects that come out of the social media analysis, onto a common, and then sort of the themes that are described, say, in the qualitative literature on a specific topic, say on MS experience, mapping them onto a common ontology, so probably something like MESH or something, and then comparing the frequency with which those themes might come out. And that's one way to systematically try to address that comparison. That is likely to be a fair amount of work, though. We haven't gotten there yet. But
okay, another theme that's emerging here is about privacy and ethics. So I guess summarizing it here, like people who are posting on these forums don't realize that their posts are being used in this way. Are there any concerns here? Is it just fair game if you post online? How do you sort of reassure the public about these methods?
Well, we gave some careful thought to this, as you might expect, both because we care about these things and because we need to get this through ethics. But yeah, I mean, I think where we came down on this was that, like, on open forums like Reddit or something like that, that is the information that is there is fair game, and I think that follows the general ethical guidelines. More closed forums, like something like Facebook or something, we stayed away from, because that actually, we feel like that probably is not clear that things might always be open to other sources. One thing that I think is a open question, but that we lean towards not doing, is trying to, so in terms of demographic data, that is one of the big things that is often missing, that metadata in say Reddit or other social media data. There are some NLP methods that try to infer demographic data from text that is not explicitly sort of expressed in there. And we feel like that might not be, certainly a lot more thought and sort of consultation maybe to go there before trying to do that. Whereas if it's clearly expressed, sort of and actively expressed demographic information, we feel like that is sort of appropriate to capture that and use that in analyses. But I don't know if you had anything to add, Larry. So.
No, I think you covered it, Nick. I think that was purposeful, why we chose the subreddit. I mean, be cognizant, this is a methodology project, and is specifically to explore the application of this methodology. So We used the subreddit for this, but we had lots of discussions around what are the other potential data sources that could be used in an ethical manner, given exactly those comments.
Great. If people are interested in using this, you mentioned a tool. Could you perhaps just sort of tell us how people could potentially use this? Is it ready for wider use?
The easy short answer to that is no. We're getting there. I think given where we've got with the support from SPORE, which isn't huge, we know that, but it was more than sufficient to get us here, and we moved significantly farther along the learning curve than I thought we might. And that's we have to give credit where credit is due, and our computer science colleagues have been outstanding collaborators on this, as have our patients. When we're moving this work with the BC CDC and some of these other projects that I talked about, those are still more, some application, but still more methodologic development before this is ready to go to prime time. But we're moving in the right direction, and that's our goal, is to get this ready to go to prime time.
Excellent. And I think we'll just do one final question. This is about, at the moment you're focused on text. Is it possible to expand sort of images and even sort of analysis of stories? Like where's the limit of all this?
I think that our computer science colleagues would be the better people to ask that. I do believe, like, certainly, like, that, yeah, their audio, etc., can be analyzed, and there are sort of more cutting edge methods to analyze that. But yeah, well, I think we're sticking with text for the moment, just to try to develop a working and validated system for text, and then maybe think about. But that's an important point, that a lot of current contributions to online data is in other formats.
Great. Well, we're kind of out of time. We haven't quite got through all the questions, but I'm sure if you have any sort of further questions, I'm assuming Larry and Nick, you're good to receive an email with any follow-ups from people. But with that, I'm going to hand back over to Belinda, I believe.
That's I guess that's it for our webinar today. I'd like to take this time to thank each and every one of you for joining us today. Please be on the lookout for the recording of this webinar on our Methods Cluster page under the BC Support Unit, along with it being available on our social media platforms. So thank you to all the presenters, and thank you to our moderator, and thank you to Amber for doing the back end work. Thank you guys for joining us. So everybody have a good day then.